COVID-19 cases in nursing homes is still wrong. Our national investigative team has been tracking the CDC's data collection for 3 months.
They've also been questioning inaccurate data being published on the Medicare and Medicaid agency website, a website meant to help keep you informed. Here's Investigate TV's Lee Zurich with a look at the overcounting the team found.
For 6 months, Sky Newell couldn't hug, even see her father.
It's hard, it's tough, especially for the kids and for him. He really misses the kids a lot, and we miss him too.
In February, Keith Broussard checked into a Florida nursing home. By March, Sky Newell started to worry if he'd survive his stay.
We were really worried about him getting COVID because he has a lot of diagnoses that would definitely be horrible for him.
With infrequent information from the nursing home, she went searching for answers.
Personally, I went to the CDC website, and then they finally put out a list of nursing homes and how many deaths and how many cases. So I would go look at that daily on my own.
We've analyzed the information published on the CMS nursing home website, where Sky Newell and many others seek information. A government site tracking deaths and COVID cases at every nursing home across the country. What we found for 3 months, the data on the site has been woefully inaccurate. And even though the federal government knows the information is wrong, it continues to publish it. What does it say to you, the fact that they know this data is inaccurate, yet they still publish it?
It doesn't make any sense at all. There's no sense in sending out information if it's inaccurate on something as grave and as serious as COVID-19 cases and deaths from COVID-19.
Since May, the latest CDC numbers show Good Samaritan Rehabilitation and Nursing Center in New Orleans had 223 resident deaths from COVID and non-COVID related illnesses. But the home only has 127 total beds. There's no way that happened.
You automatically know it's incorrect. But I think the real question for us is, if this is happening on this website and all of this information is being collected by CDC, at what point do they raise the flag to see that there's a discrepancy in this data?
The CMS site also shows that New Orleans nursing home has 56 COVID deaths, but the state of Louisiana only reports 5 COVID deaths at that facility. When Sky Newell goes to the CMS website, she sees 3 COVID deaths at her father's facility, a number that matches state records and the facility says is accurate. But knowing other numbers are off, she worries about the accuracy of the information American families are getting about outbreaks in these facilities.
I don't know how to feel about it. It's sad, really.
Lee Zurich, Valley News Live.
Good Samaritan in New Orleans says the state's count of 5 COVID-19 deaths in its facility is accurate, not the 56 reported on the CMS website.
A spokesperson says all 5 deaths were early in the pandemic and were residents who had many high-risk medical conditions.
Encouraging news for people with type 2 diabetes, how a drug you may be taking could protect you against dementia. It's next on Valley News Live at 10.